age, you take up different.
This meeting is being recorded.
As you age, you take up different read other books and the materials like that, or they use the computer. So to avoid eye strain while reading, just read for 20 minutes and then relax and look away for 20 seconds, and look at something, maybe 20 feet away, just to avoid eye strain. And if you do read and you're using reading glasses, it might help to also to avoid strain. It might help to have anti-reflective lenses. So those anti-reflective lenses can cut off the harmful radiation from the devices that we're using now. Most of us are either on phone or on the laptop, and most of the screens of computers now are exactly 4K, just like the screens of smartphones. So as we use our smartphones all the time, we should make sure that, because most of us are going to be using reading glasses. I'm using reading glasses right now. So most of us, we need to have anti-reflective coatings on our lenses. We can actually have, blue block lenses, which cut out the harmful blue rays from these devices. So these are the simple things I would suggest you do just to keep your eyes strong, And I also want to mention about signs of an eye emergency. You have to see an eye care professional right away if you have or you notice the following things. If you suddenly cannot see or everything looks blurry, you just know that you right away you have to see an eye care practitioner who will now do an examination and tell you what it is. If you see many new floaters just developing, tiny specks, suddenly you're just seeing tiny specks or cobwebs that seem to float across your vision, that is not good. Or if you have flashes of light, flashes of light, if suddenly you see flashes of light, it could be a result of anything. It could be a retinal problem, it could be glaucoma, it could be anything. So if you have flashes of light, or you have sudden new floaters, just see an eye care professional. Of course, if you have eye pain, because different eye pains might mean different things, don't just think that it's just pain and it will go away. Some of them may not go away. They may be the beginning of very serious problems. You should see an eye care professional. If you experience double vision, if you are seeing double, then it's not a normal phenomenon. So if you have double vision, definitely something serious is about to happen. So just see an eye care professional. Of course, if you have redness or swelling of the eye or eyelids, of course, when you have redness like that or swelling, you could be having an infection or an inflammation, which requires examination and treatment. I would say you need to love your sight. And just like I told you, I love mine. If you love your sight, you have to treat it properly. And the proper treatment for the eye or your sight would be to do those things, to see an eye care professional regularly, and then take all those steps that I mentioned. Thank you very much. At this point, I will stop and ask for questions. If there are questions, I'm available to answer. Thank you very much to COSROPIN officials, COSROPIN officials. I appreciate the call to discuss with you today. Welcome to the World Side Day.
Thank you so much. Thank you so much, Dr. Nkem. You really dealt with this, and it's very eye-opening, very information-packed. We're very grateful that you availed yourself of this service. Thank you very much. And today, quite a few things that is my take home. And one of them is knowing that when you're approaching old age, you have like about 5 different desires. One of them is vision, the other one is mobility, sound mind, good health, and money. This was very much elaborate. We not really pay more attention to the money part, and especially the health part, because most of the time when we have these webinars, we do not get a good response as we expect, because if actually we place a lot of value on our health, we would be able to avail ourselves to these wonderful lectures. I want to thank you again as I continue to elaborate on some of the things that you have brought to our notice. You also told us about the common causes of eye problems. You know, before now, I didn't know that the kind of work you do affects the diagnosis of the kind of lenses that may be recommended by an eye specialist. It was an eye-opener to know that it's actually put into consideration. Some of the common causes you mentioned was cataract, glaucoma, age-related macula, and all that. But out of all these ones, the very common ones are the cataract and glaucoma. And I'm very happy that you really explained how it happens and what we can do about it. For cataract, you told us that it is age-related and that and it is treated by surgical means. And you said it is one of the major causes of it is better we dictate this on time, and that we should know that it is irreversible, and so on and so forth. I would like to also reiterate on something you said here concerning regular, when you started telling us about what we should do to maintain our eyesight. You told us about regular visits to the optometrist. I'm very sure that most of us don't do this. And many times we go seeking for roadsides and all that. Maybe you say 1 or 2 things about that. And sometimes we pick our glasses from the shelf. I don't know if that is okay. Like when people go for health, when they go for health, you know, evangelism or programs, you see these people come and they give blanket glasses, and you might need to talk about that too. And then you also told us that smoking affects sight. I would never have related smoking to sight, but that we should also eat good food and control our blood pressure. For some of us who have the blood pressure that won't take drugs, it's important that we know that it has effect on our eyesight also. Control diabetes, in fact, control all the sicknesses and all the illnesses. And then finally, you came to signs of an open an eye emergency, when we have blurry vision, tiny flutters or flashes of light, double vision, redness, swelling of the eye and eyelids, and all that. It's been such a wonderful time. Please, if you have any questions, could you just go to the chat room and we'll take those questions. Thank you. Thank you very much, Dr. Kim. As we continue to take this, as we continue to take questions, we hope you'll be able to answer them for us before we close.
I'm here. I'm here.
I'll take some of the comments here. Rhoda is saying that awesome. Thank God for this opportunity. Thank God for leadership of COSROPIN. Most educative. And then Esther is saying, wow, this is loaded and instructive. I am so grateful that I am here. God bless you richly. I use glasses and I've had surgery for cataract. Thank you for this awesome education. We don't get this information from our doctors in spite of regular visits. May God reward you adequately. Amen. Thank you so much. This is from Obina. He's saying that thank you so much for this informative session. Happy celebrations, family. Good morning, all. Obina. Then we have Waneka is saying, good morning, everyone. And this is Waneka from Lee Saxon. Thank you, doctor. This is informative. For you, COSROPIN, thank you, COSROPIN, for putting this together. I hope you will avail us of the recording, especially for those of us who have issues logging on. Oh, so sorry about that. COSROPIN has, if you go to YouTube, you will see all our medical webinars, and this is one of them. So kindly log in and leave a comment in the comment section. And then we have finally Olayinka, one of our board of trustees, Ejomole, saying, thank you very much, Dr. Kemp, for an educating lecture, age-related vision impairment and regular issues with care of older persons. Kindly examine how diabetes and high blood pressure affect and result to glaucoma. Okay, doctor, so you've had these, some of them have the questions, so could you just take them quickly, and then we can move on. Thank you so much.
Thank you.
Dr.
Thank you. Unfortunately, my video refused to work, but I think you're still hearing, you can still hear me, right? So, if I remember the questions as you were reading, there was one you said about picking up glasses without prescription and all that, without examination. It's my take on that will be, can you hear me now? Please, can I be heard? Can I be heard?
Yes.
Very clearly, sir.
Yes.
Okay.
Yes.
Hearing you very, very well.
Yes, we can hear you very well.
Okay. So my take on it is, like I said, I was just, the other day I was watching TV and I saw an advert from a drug, anti-malarial drug company where, or is it, I think it's from the Federal Ministry of Health, where somebody was just felt she was sick, and she decided to go and buy drugs from the pharmacy without prescription. And what I would say is that, you don't take chances, because if you just go to the roadside and pick up something, you might see, you might think you are seeing, but it may not be the right prescription, and at the end of the day, you will have more problems from using that roadside pair of glasses, than it will become penny wise, pound foolish. Of course, what's the attraction in those things is price. They tell you, well, you can get it for 500 naira or 1,000 or 5,000, and then you think going for an examination and probably spending 10,000 or more will be too much for you. But what I would say is that we attach value to the wrong things in Nigeria. If there was this discussion about a lady that was asked to do an examination. She was supposed to pay the doctor 15,000, and she said it was too much. She wanted to pay 2,000 or 1,500. Imagine her valuation of a doctor that spent 6, 7, 8 years in the university to pay 1,000. And then the same lady ended up, somebody passed with a pair of shoes that cost 50,000, and she deposited 20 immediately because she didn't want to lose the pair of shoes. So this will tell you where people's values are. But the right values as you age will be to just make sure that you keep healthy. So it's best to do a proper examination before you get pairs of glasses. Forget about the roadside people. They're there to collect your money. They are not there for any good for you. They don't represent anything good for anybody. So that's one. I don't know, what was the second question? You were reading very fast. I couldn't write down all that, but I know somebody said something about diabetic retinopathy and hypertensive. How does diabetes? Definitely, I'll just be very simple. Uncontrolled diabetes will eventually affect the retina. The retina is the back of the eye where images are formed. So if most of the retinal surface, if most of them are unhealthy, then the images that are formed will end up being in patches as they are sent to the brain. So I'm just being too simplistic, because if I start explaining it will mean going into very detailed medical terminologies. So the same thing, if you have hypertension, it will now end up affecting the retina, and any part of the retina that it affects will, end up not seeing properly. In the case of hypertension, there are even cases where the blood vessels in the eyes will burst and shed blood. And shed blood in the eye, inside the retina. So to clear that blood will take a lot of hectic, medical effort to resolve. So what you should know is that definitely, without having to try to treat it when it happens, just try to manage diabetes properly and manage hypertension so that it doesn't get to the eye. Because at the point where it gets to the eye, it's been left unmanaged, and it would not just damage the eye, it will damage other organs of the body, definitely. So I don't know if there's any other question. If there's anyone you remember or you want to re-ask, I'm here to answer. Thank you.
All right, thank you very much. I think you covered almost all of them. I was logged out, so I don't have a history of the questions, but from what I read, I think you have covered all of them. At this point, I would like to say a very, very huge thank you, especially to those that have stayed to the end. And
Hello, you're muted. Hello? Okay.
You're muted.
You're muted.
Victoria, you're muted. No.
thank you.
Yeah.
All right, so I was saying that before I got muted, I was saying that at this point, we want to take a vote of thanks from our very own Board of Trustees, our very own Board of Trustees, Madame Josephine Aneni, I don't know if you're available to take this vote of thanks.
Well, before she takes the vote of thanks, I want to join to thank the doctor and to inform our participants that one of our NGOs called Graceful Aging Fellowship, every last Saturday of the month, looks at matters of this nature. The eye, the kidney, all functions of the body, and it's normally be 8 o'clock and 10 o'clock every Saturday. That is the last Saturday of each month. We bring in doctors in this similar way so that they can learn more about how to age gracefully, live long and healthy, in addition to the exercises they do every Saturday. So I want to encourage those who are on this platform, Abuja, to also take advantage of this. Every topic relating to every part of the body is normally looked at as it affects older persons and how to manage their situations. Thank you for that addition. Thank you, Doctor.
Thank you very much, sir. I appreciate the call.
Okay. I wanted to also say that before I hand over, that yes, it looks like everything that we're doing has a lot to do with exercises. And exercises kind of give solution to almost every solution to health and health-related problems. And thank you, Senator, for reminding us that one of us, and that is your NGO, Graceful Aging, actually deals deeply and well with this subject. Thank you. I'm handing over to you, Honorable. I'm calling on.
Oh, yes, okay, yes. I want to begin, first of all, by thanking COSROPIN and our president and our secretary, especially for putting this together, because if they didn't put it, we would not have been able to benefit from what we have benefited from today. I want to thank them also for finding, I think she said one of the best, I may say the best lecturer, the optometrist lecturer that there is in Nigeria, Dr. Nkem Okorafo. I want to thank you.
Thank you, ma.
I want to thank you for the details, for your patience. In fact, after this seminar, we should all have a certificate in optometry, everybody that attended.
Thank you, ma.
Oh, yes.
Yeah,
There's nothing in optometry that we didn't learn today. You know, thank you very, very much for that. I want to thank everybody that has come on this webinar for the time you have invested and you have profited. The time you have invested, the profit is, unassailable. And I just, sorry small for those who miss it. For those of us who came, please spread the news that these seminars are invaluable. These webinars by COSROPIN are invaluable. If you have to go out to lecture, you know how much you will pay to get the information that we are getting free of charge. So for people who are wondering what they gain by being members of COSROPIN, this is too much. So thank you, all of you, for coming. And please tell others who didn't come, the next month they should come because they are missing so much.
Thank you, ma'am. We are so
Thank
grateful
you,
for having you.
everybody. Thank you. Thank you, everybody.
Thank you, ma'am.
Thank you so much. At this point, we want to bring the webinar to a close. I would like to remind us that we have other webinars coming up this month. And on the 20th of October, And it is for those people that have interest in developing NGO, and for those ones who have their NGO not properly registered or properly put together, please do watch out. On the 20th, we will be taking another specialist in this area to tell us exactly what to do to make sure we are running legally and properly. And once again, from this end of COSROPIN, we want to say a huge thank you to Dr. Nkem Okora for giving us this time. And want to also celebrate again and again and again our very own president, who is now OFR. I want to keep celebrating him. You know, he's putting so that we get to where we are going to. And with this, I hope to see you on the 20th as you come in. Do tell a friend. Next month, we'll be looking at stroke. You'll get the exact date for stroke. It is on the 29th of November. 29th of November. World Stroke Day is on 29th of October. So expect to see us again about the same time, but on the 29th is Saturday, same time, 10 o'clock. See you then. And thank you for your time. And bye-bye. Thank you.
Thank you. Bye.
End the meeting, yeah?